Look at this story as well, because more people than ever are getting cosmetic surgery in the UK. Figures from the British Association of Aesthetic Plastic Surgeons show there was a 13% increase in cosmetic procedures, with liposuction showing the largest rise of 20% on last year. So a big rise. Women accounted for 9 out of 10 procedures, but surgery on both men and women increased. Adrian Richards is a cosmetic surgeon in Buckinghamshire, a member of BAAPS. Adrian, good afternoon to you.
Good afternoon.
Welcome to the programme, Adrian. When you look at this increase, what do you put it down to?
I think it's really difficult to know. It may be a number of factors. One may be that people are coming out of the recession. People may feel that it's more able to do these procedures. I think the other thing is there is a bigger acceptance, perhaps of young people, of these type of operations. But it's important to emphasise that a lot of these operations aren't just purely cosmetic. A lot of them are what we call functional, and that means they're improving actually the function of people as well as the way they look.
Okay. We've seen in the last few years the rise of sort of minor interventions, but the idea that you're sold an idea where have a jab here and all of a sudden your wrinkles will disappear, or have a jab in your neck at lunchtime and you go back and you look 50 years younger. Is that part of the increase in figures?
Yeah, this actually was in surgery, so there has been a big increase in the number of what we treatments. But these figures from the British Association of Aesthetic Plastic Surgeons were actually of surgery. So the biggest increase was breast augmentation, up 12%. And that's an interesting one. Breast augmentations have always been quite popular, and normally they're divided into two groups of people. So it's either the person who hasn't really developed bust or will develop very asymmetrically, or people after they've had children who've lost volume from their bust following breastfeeding. So I mean that's a big one up, and lots of the other procedures, eyelid surgery, and also breast reductions are up. So we're up really across the board.
And of course, people are much more prepared to not just accept or discuss the fact, but they'll flout the fact they've had some sort of intervention.
Well, I did hear a story that in Brazil, some people had the scars of a facelift without having the facelift itself, because there's quite a lot of kudos in being wealthy enough to have a facelift.
That's unbelievable, isn't it? That's unbelievable.
It is strange. So, why do you think these figures may be up? I'd be interested in your view.
I think more people want to look good or feel better about themselves, and I don't know. Maybe it's because the advertising is available. Because if I understand why if someone has a genuine need, if they have some sort of issue, maybe a disfigurement that needs correcting, clearly there's a deep issue there to be resolved. That's fine. But also, I think more and more of us are the fact we don't want to get old. We want to stop the aging process. We want to change the way we look, and we tend to think some people think it's very easy. I'll have this taken out. I'll have this put on, I'll change this bit of it, and it's become the norm.
It's become more normal, and I think perhaps in the way we live now, there's more negative discrimination against people who look slightly older. So I've got a lot of friends. I'm in my young 50s. I've got a lot of friends who do find it difficult to get jobs because after you get to a certain age, I think looking slightly older is difficult in the job market. So perhaps that's another reason.
Yeah, I think you're right. It's a societal problem. But of course, yeah, you're right, because people dye their hair, they'll dress differently to the way their parents or grandparents dress at the same age, and it is this constantly evolving cycle. But it is those people. It does concern me, Adrian, those people who will spend a couple of £1,000s because they want bigger boobs, they want cheekbones, and you just think, well, is it really necessary?
It is really necessary. No, I would 100% agree with you. So we at Aurora clinics turn away more people than we actually treat. So if someone, there is, for instance, a trend for, Kim Kardashian, the bigger backside, basically. Now, is it really ethical to put buttock implants and give people, bigger backsides, because that is fashionable at the moment?
See, Adrian, I have never. I don't understand the Kim Kardashian phenomenon. I understand why she's popular, but not the root of it. But bigger bottoms. I thought the idea was to have a smaller bottom.
Well, that's what I thought as well. But but there is a bit of a trend to be bigger area now. a trend for today. Now, in 10 years' time, that may not be the trend. So what we don't want to do is to create problems for young people that are going to be very difficult to resolve in the future. So I would 100% agree with you. I think we need to be very cautious and really counsel people about having plastic surgery, because young people, they have tattoos, they do things that perhaps they may regret later on in life.
And the advertising is very... Does that need to be curtailed?
I think it does. I mean, BAAPS have really quite strong rules on this. So anything that's unethical, anything where one surgeon claims something is better than another surgeon, or someone claims something that isn't true or isn't actually scientifically proven, or anything that any incentive to have surgery. For instance, there was a clinic that was running a competition to win a breast enlargement. Now, that is considered very unethical and would be very frowned upon by BAAPS surgeons. And if a BAAPS surgeon did do that, they would be dismissed from the organisation.
Adrian, thank you. Well, I don't know how this bottom enlargement thing works, but if you need a large bottom to give to someone else, you can have mine. I want to get rid of mine as quickly as possible.
Yeah, great. Well, have a great afternoon. Thank you for having me on.
Thank you.